Coming up in this week's episode of Next in Line.
If they went into schools and said to girls, this is what you look like before, have a baby, you're going to look like this, it probably put off a lot of teenage pregnancies. Every night, virtually, he has a tub of ice cream like this. And he's made me into a secret alcoholic person as well. Alcoholic? No. I don't think it's terribly flattering for older hands, do you? You be honest. No. I looked at my stomach and it looked like a football that somebody had pierced, and it was all uneven like this.
They don't tell you it, do they? They don't tell you any of this.
No, and I remember saying to my mother-in-law, you didn't tell me about this, so sure it was a bit late by the time you were pregnant.
Be advised that this episode of Next in Line features some talk of self-harm.
Welcome to Next in Line. I'm Sophie Cooper and I'm joined by my mum, Lesley Reynolds. On our podcast, we're talking everything beauty, aesthetics and running our clinic. So this week we're talking all about scarring. So mum, what have you been up to this week? Well,
another crazy week here. So we had a birthday party for Ruby on Sunday. She was 9, I can't believe it. It's just gone like a flash.
I remember seeing her in hospital. Tiny little baby.
Yeah. Oh, and it was so exciting. Very first grandchild. It's exciting. Everyone's really exciting, though, to be honest with you. But 9, I can't believe it. There's been quite a few since then.
So I hear this week you had a bit of a to-do with the shopping. What happened?
Well, do you ever let your husband go out shopping with you?
No.
Don't ever let your husband go out shopping with you. If I take him shopping with me, my bill's probably 3 times the amount. So what I do now is I say, I haven't got my card with you. Do you want to pay? Because I think, pick up what you like then, and I don't care. So I asked him on Sunday. We were slightly short of a couple of things, like a loaf. We couldn't find any onions. There are loads of onions in the garage, but we couldn't find the onions from the garden. And I wanted a pepper and a lettuce. Mm-hmm. And he came back with 3 trays full of food, 6 shopping bags, 5 loaves.
You were fuming.
I was fuming.
Why?
Why 5 loaves? I said, where are the fishes? 5 loaves. I asked him to get some bread rolls, I think. And packs of bread rolls, 5 loaves. What else did you bring back? It was crazy. 3 packs of peppers. Well, you know he's like with ice cream.
He's an ice cream monster,
He's an ice cream-aholic. I say every night, virtually, he has a tub of ice cream like this. And he's made me into a secret alcoholic person as well. Alcoholic? No. Ice cream-aholic. Well, probably alcoholic as well. But so I was sitting down on the sofa, dozing off, and this spoon comes in front of me like that with ice cream, laden with ice cream. I wonder why I put weight on.
He did that to us when we lived with you. Yeah. And Bella was a tiny baby. It would be we'd go to bed early and it would be about 9:30, 10, the door would open. And obviously 2 ice cream bowls would become... We'd get up and eat it.
So that is Arma's way of... That's his... Have you heard about this love language thing?
Yes.
We talk about love.
Yeah.
So his love language is food. And it's feeding. And he's a feeder and a feeder and a feeder. So that's why I bought... He just brings so much food back. So I try to go shopping on my own. And what I actually do now is to do a lot of online food shopping that is delivered before his home.
To stop the...
But if there's anything missing, it's like, I'll go down and I say, no, please don't go shopping.
That happens to me with Dan, though.
Does it? Because I had a platter of cheeses ready to go out. And I didn't ask for cheese. And when he came back... And it was a big platter, it wasn't a small platter. When he came back, he had 3 times the amount of cheese that I already had on the platter.
Bless him.
So what does Dan do when he goes shopping?
He goes shopping, I give him a list, and I do the list in the aisles of the fruit, the veg. Oh no, he'll come back with just basically, he gets these big cardboard boxes that he fills up. He comes back with all different salamis and sausages and just snacks. And then
anything he fancies.
And then a roast. He always comes back with a massive roast and that, so what did you get? Oh, I forgot that.
So if he gets the meat for a roast, does he get the potatoes and the vegetables to go with it?
Yeah, he'll get that meal, but he won't get anything else on the list. He'll be like, oh, I forgot that. I'm like, it's on the list.
Do you think it is a man brain where they actually forget and just go in and buy whatever they like? Or do you think it's a ploy to stop you asking them to go again?
I like that. Could be a ploy. I think they're just different creatures.
Well, yesterday I didn't say it, but I look at it all and I think, how much did that cost? You know, you should have spent like 20 quid at the most. It's probably hundreds of pounds for the stuff.
That's why you're popping the champagne, walked away.
Well, I did. I popped the champagne. I thought, I'm going to hit the ceiling in a minute and the other thing was he came back after the guests had arrived and I was like, oh. And
you were a bit spicy, weren't you?
I was a bit spicy yesterday. Felt a bit spicy. I thought, actually, have a glass of champagne and pretend it hasn't happened. And Layla said, should I just freeze all this? I said, I think so. And he doesn't just buy a loaf. It'll be the most expensive loaf or loaves in the shop. I think he goes around and looks at the price and thinks, oh, that must be better because it's this or that. It drives me insane.
Although the kids love it when Dan goes shopping because he comes back with really tasty stuff.
Does he?
Like this pork belly slice and like all these meats.
Well, I've never had that. Is it nice?
Oh, I can't stand it, but the kids love it.
Well, do you have to cook it or is it already cooked?
No, it's like a cured. He comes back with all the cured meat.
Is he? Actually, I noticed that yesterday when I put out cured meats. Cured meats, fresh chicken, drumsticks for the children, quiche, and made lovely quiche. I thought it was lovely anyway, and salads. But actually, the cured meats just went like crazy.
Yeah.
And even the kids, even the babies who are a year old were eating cured meats. So, what have you been doing this week?
This week, I've been getting over my back injury. It's not an injury, but my really bad back.
It's really bad, your back, wasn't it?
And
how did you do it?
I think packing and doing all the washing. So I've been making Dan do the washing.
Poor old Dad.
No, but I was getting worried because when you hurt yourself and you think, oh my God, is it something serious?
Yeah.
I suddenly go down like I'm dying or something when I've just pulled my muscle.
A bit of hypochondria comes in.
Yeah.
Well, we all do that, don't we?
And my nails.
I did notice your nails.
Absolute state. But I was worried. I started taking it all off because, have you heard about all the bad things that are in gels and everything?
Yeah.
TPO and...
I was looking at them this morning actually and thinking, because I've had this really very, very light one, I have mine cut really short.
Yeah.
They're growing a bit now. This is 2 weeks, but you can hardly see that it's grown because it's so light. I don't think it's terribly flattering for older hands, do you? You'd be honest. No.
No, I like that kind of colour. This is not flattering. I'm not even going to show them because I'm ashamed. It's real life though, isn't it? Things happen.
Well, they just pop off sometimes, don't they? When they're shorter, they don't.
This is biab. This is my nails, but...
Your nails with biab. I've got biab on as well.
They've cut, it's gone raw. When it's really low.
Really low. It's painful,
it's
isn't
painful.
it? Well?
The pain when you do a nail like that.
What are you going to do then? You're going to keep having it or are you deciding not to?
I think because you get a lot of the gels now, so it's banned, isn't it, in the EU countries, but here...
I think the problem is that once you start having them, and your nails grow a bit, and when you stop, they just break straight down again, don't they?
What I'm going to do is go tonight for a late appointment, get them done. Yeah.
Get them done. They're
I
lovely
can't
and
walk around
long.
like this.
Well, you can't, can you?
You're going to kill me. So obviously we're going to talk all about scarring this week.
Yeah, I think I've scarred the production crew by moving the room round as I have. First thing they said when they came in was, I said, the room looks lovely, doesn't it? And they're like, but it's autumnal and I like to have the fire on. I like sitting by the fire.
It is really
sitting
lovely.
Here, reading or just being quiet. It's just so nice to sit by an open fire, isn't it?
It is lovely. It's a bit hot.
Yes, I was thinking that too.
I'm not going to lie, it's a little bit.
So you want to talk about scarring?
Yeah, so I think scarring's huge, isn't it?
It is. And I always find it interesting that people come in and say, I want to speak about my acne scarring. And actually, what people think of as scarring is pigmentation a lot of the time. So with your skin, when you get a spot, if it isn't treated, lighter skins it will go purple. And as your skin gets darker and darker, you can get pigmentation, post-inflammatory hyperpigmentation mark. So that is a form of scarring. But for me, scarring is where the skin has actually been damaged and you've got a ice pick scar or a box scar or a keloid scar. Maybe you've had an accident, you've got a scar. Stretch marks, people call scars.
Yeah, we get a lot of stretch marks, don't we?
A lot of stretch marks. So there are a lot of different types of scarring. We do a huge amount for acne scarring. And for self-harming, that's another massive thing. I think the self-harm
scarring is kind of one of the most when you help someone with their scars and they tell you, they let you into why their scars are there instead of just presuming what they are.
We
There's
see a lot
normally
of people
story.
with self-harming up here, tops of the arms,
Yeah.
inside the forearm or thighs.
Yeah.
And I mean, there are a lot of things you can do. And it's definitely worth coming in and speaking to somebody about it. So we do a lot of work with microneedling, sometimes with laser. And I don't know if you've noticed it, but with a lot of self-harming scars, they're slightly raised.
Yeah.
And we do a lot of treatment with laser and with PRP, so regenerative treatments, exosomes. There's a lot you can do, and you can certainly improve them. The difficulty with scarring is that it's hard to ever get rid of a scar completely.
You can't, can you?
You can't, no.
You can't.
But you can make it look a lot better than it is. So whether it's white and raised, or it's keloid, or if it's purple,
What
dark
type
brown,
of scarring
what
is
type
important
of scar it is, yeah.
to how you treat it, isn't it?
Yeah. And we do a lot of scarring from acne. So people that got pitted scars on the face, we do a lot of fat transfer with PRP, and probably a couple of treatments with subcision. So subcision is when you go down into the skin and cut the tethered part, and it raises. And then we can put fillers in there. They won't last, or we can put a little bit of fat transfer in, last longer.
I think you're going through so many. For people, they won't know all of these things because we just are used to all of these different
it's that
things.
part of our daily life, isn't it? We talk about scarring all the time.
But if someone was to come in with any type of scarring, how would you start it off? What would you say for acne scars?
Well, there are lots of different types of acne scarring, as I said.
Yeah.
So with acne scarring, you can get pigmentation marks.
Yeah.
So we would probably, for that, use skincare, medically based prescription strength skincare, probably. Or sometimes it might be chemical peeling would help. Exosomes could help. And then the next scars are when you get an indentation mark. So it can be very deep ice pick scar, which literally is a deep little scar, or a box scar, so it's flatter and not as deep. Yeah. Other scarring that you can get, and a lot of people do have it, actually, is particularly around the back of the head and back of the neck, and with darker skin types, is keloid scarring as well.
We see loads of keloids, don't we?
And we inject it, so it's injected. Yeah. And the thing with keloids is to remember that when they're itchy, they're active. Yeah. So a lot of people come there like rubber, really thick and hard, and it's uncomfortable having them injected, but they go down quite quickly. Yeah. We also, Dr. Khan does a treatment where he would take a keloid scar out. If it isn't active and it's raised, he actually takes it out from the base, and that actually gets rid of them as well.
So is that cutting them out?
Yeah,
and then
cutting them out, yeah. But I think with acne scarring, and we see a lot of older people that had acne maybe in their teens and 40s, 50s will come in, particularly on the temples and the side of the face. And subcision, which is going down and releasing the tethering, because when the scar is tethered like this, there's nothing really you can do. We do CO2 laser and it does work to a degree, but you need to actually put back that level that's actually missing in the skin. So a little bit of subcision, where the skin is just untethered, obviously under local anaesthetic, and then you put in either a filler, which would be less expensive and instant, and will last a certain amount of time, or you would take fat from around the belly button, process it with some PRP, and then put that in there as well. Just makes the skin nice and smooth.
It's the combination, isn't it?
It's a combination, yeah. We still do a lot of CO2 for scarring as well. I actually had CO2 laser on one of my hands. I don't know if you can see this here. I had 2 rows of laser on there, didn't have any on there. This was probably about 15 years ago, and the skin is still better than that.
I remember
part
that.
Of the skin. Do you remember it?
That took a long time, didn't it?
That was a Fraxel.
That must have been really
deep
painful.
laser. It was very painful, yeah.
Actually, you know,
that's why I only had 2 strips.
You know my friend Adam?
Yes.
He's so lovely. He did, when he was 15, his acne was so bad. Yeah. His skin's amazing now. But he always says about when he had the Fraxel, he said, your mum was so lovely. She was holding my hand. He was trying to fall off the bed nearly because it was so painful.
Yeah. Well, laser it is painful, but you have much better local anaesthetic now. and
creams, haven't we?
And creams,
Topical creams.
So not so bad. But when I had that done, I don't think I'd let the cream stay on for long enough. But Frax was a really good treatment still.
Yeah.
CO2 is a really, really good treatment.
I think so.
Gold standard, I think, for scarring and for anti-aging. And actually, we use a lot of smart side CO2 for people that have got rosacea. So it's quite universal, isn't it, really?
Yeah.
Yeah.
So I always think, going back to like the self-harming scars, when you do a consultation for that, what's it like? What do you...
Well, I usually just ask people to tell me what is their concerns, what's happened. And they're usually in a place in their life where they're feeling a lot better about life generally. And what they want to do is they want to try and erase that memory. So it's very heartfelt time that you spend with people. And they tell you, sometimes people tell you what was going on, why it happened. Other people don't want to talk about it at all, just want to know, can you get rid of this? Can you get rid of this mark? I don't want everyone to see it.
Yeah.
So I have had people where the scarring has been so bad, you could improve it, but little. And they've actually had tattoos over it.
Yeah.
But you can still see that raised scarring underneath. I think it's good to be able to deal with it and get it as flat as possible before you do anything else. And obviously, the earlier the better.
Yeah. People don't know that, do they, though?
No. And generally, people that have got self-harming scars, they're quite young when they do it. So I see a lot of people in their late 20s, early 30s, where they're deciding they just want to move on from that period of time in their life.
I've seen a couple of people that I've done consults will come in with their parents, with a parent, and they kind of open up to you about it, and then you can work a plan out which is going to be best for them.
Well, they're not going to go. The scars are not going to go overnight.
Of course,
They'll
and you've got
never
to
go.
manage that expectation, haven't you?
Absolutely. And they'll never go completely, but they can really fade.
Yeah.
And I think that's the important thing that people understand. And as you say, expectation is so important.
Yeah. But there's so many different treatments. I think we've also done this silicone gels. They work really well. And tattooing now. You can
Tattooing
tattoo
is-
over
is
them.
brilliant
If you
for
get
it,
it flat enough and then camouflage.
Yeah.
I've seen some great work with
Yeah,
that.
I have too. I've also seen people who have had, so they have a scar and it's just slightly pink. It looks so much better than before. It's those slightly raised white ones that are more difficult.
Yeah.
When you get to that pink, flattened pink, and they've had micropigmentation, which is tattooing really, isn't it?
Yeah.
The same sort of micropigmentation you have around your eyes or eyebrows, and they've had it into the scars. And people have that as well around the nipple, if they've had breast surgery or, with stretch marks. Scarring is a huge, huge area.
It really is. It is. And I think it can give people quite a lot of anxiety, all their scarring. And a lot of people say, I never wear in summer. I'm going around in long sleeves because I'm so embarrassed. And I think when you can treat it and they come back and they're like, somewhere I can go, I'm in a top, and they're so happy.
Yeah. Well, it's horrendous.
Yeah.
So stretch marks are a really big problem. I mean, my mum had stretch marks, not that many, and I've got a few on my thighs after having you, and I've never worn a bikini since. I don't think I wore one much
You haven't
before.
got any stretch marks?
I have got about 2 or 3 little very fine ones on my thighs.
My ones are horrendous.
But isn't it because, I was talking to Arma about this, and we were talking about why do some girls get stretch marks and some don't? And he said it's because the baby takes everything from you that it needs and you get left with whatever's left.
Really?
So if your diet isn't great in pregnancy, you just eat everything you want rather than making sure you take the food that you need.
Basically telling me I was greedy during my pregnancy.
Do you remember how nasty you used to get in your pregnancy with food?
Me?
Yes.
Yeah. Don't take my food.
I can remember the falafels in the
The
fridge.
falafel incident. Someone took my falafels. I was fuming. I was so pissed off.
I know. You're so funny.
Really nasty about. I know.
No. That was in the clinic,
my
wasn't it?
stretch marks, I used the Mamma
Mamma Mia. No,
Mayo, Mayo something. Mama.
Mama.
And I used their cleanser, which was fantastic.
Was it good on stretch marks?
Well, not on stretch, but on my face.
Is that right? Okay.
Just to cleanse. And then I used the balm.
Yeah.
I did it all the time, every night.
Was it good?
And then I got to about 8.5 months pregnant, and suddenly it looked like a cat had just scratched me. They were red. But at the time, I wasn't bothered. I was just like, oh, don't care. Then afterwards, when you've had the baby and your tummy goes...
It sounds like deflated football.
I was like, oh, this is lovely.
I remember that with Luke, when I had Luke, and I looked down at my tummy after he'd come out. He was very overdue, and he was quite big, with his big baby. I looked at my stomach, and it looked like a football that somebody had pierced, and it was all uneven and like this.
They don't tell you it, do they? They don't tell you any of this.
No, and I remember saying to my mother-in-law, you didn't tell me about this, so sure it was a bit late by the time you were pregnant. Very wise words.
Yeah. But no, I think Arabella, so we were on holiday in Greece with Ruby and Arabella, and I was in my bikini.
You wore a bikini?
Yeah, I did wear a bikini.
Good for you. Why not?
But yeah, I put my bikini on.
You've got a lovely figure.
And they said to me, they were like, oh, what's that? Ouch. And I was like, oh no. I said, when you were in my tummy, my skin grew so much. And then these were the marks that I'm left with. It's like a tiger. They were like, oh, that's so cool. I was like, yeah, it's so cool.
That's a really good thing to say to kids, though, isn't it? To say to girls and boys.
But I think some people, I don't know why I've got a confidence now, where before I had children, I had really not a lot of confidence. Now I'm more confident than I've ever been.
Tiger stripe. And that's why, I'm a mummy, and that's why I've got them. But it's so good to say that to kids.
Yeah, to be like, this is, this is what happens.
Yeah, and why should we be ashamed of our bodies because we've had children?
Exactly.
Why should we?
But I know, but I think some people do feel, don't they, after stretch marks really affect them, and they're really upset by them.
Oh, your mummy tummy, saggy boobs, it's great, isn't it?
Are you talking about me?
No, I'm talking about women in general. I mean, when you have a baby.
I know.
I say this actually, if they went into schools and said to girls, this is what you look like before, have a baby, you're going to look like this, it probably put off a lot of teenage pregnancies, because actually you don't realise I think everybody's body changes when you have a baby.
Definitely.
But I do admire girls that get straight back, to exercising.
You made me, but I'm so thankful for it, and I lost the weight really quickly. Could do with you now telling me I need to get back.
Was it when I said the PT is arriving?
Yeah, the PT is arriving.
Mm-hmm.
But no, but I think I think it's good to show the girls, like, this is what happens.
Oh, yeah,
and it's okay. Like, it's you've had a baby.
Yeah.
Your body changes how I feel. Doesn't it? I actually feel okay with them.
I have patients coming to see me and talking about the tummies particularly, and they say, I want a pre-pregnancy tummy. Well, you're never going to have that pre-pregnancy tummy, are you, ever? As thin as you get and how much you get back into shape, your skin will be different. Skin is always that bit stretched, isn't it? Even if you get that really flat tummy, your belly button's usually a little bit of a different shape. Yes. The skin is stretched just that little bit. Yeah. And it doesn't completely go back.
It changes you, doesn't it?
But, your attitude and how you deal with it. Like, this is when you're in my tummy, these are my tiger stripes. And
they were touching them. They're like, wow, this is so cool.
You're like, great, thank you very much.
No, but I think it's good for them to know that it's okay, especially with what we do.
Yes.
Because we always are, and Bella always hears everything we're talking about.
Yeah.
Oh, neck tight, this. So I think it's good for her to know, like, actually it's okay to have all these imperfections, It's normal.
No, I love that attitude. I think it's really, really good. I don't think I ever said anything like that to you, did I? I'd get back in the gym. But you got back into shape, I think, really quickly.
Yeah. No, I think so.
It's good, and you were young. I remember saying to you, well, you're still very young. You need to get back with the PT. And you did, because before you had her, you were very, very, very fit, weren't you, when you got married?
Yeah. Dad and I were saying that the other day. We said, God, we were so healthy. But then I think things get in the way, like working, busy. You have to make time to actually do the things. So,
actually, I think as well at that time when you all got married in 1 year, three of you all got married in 1 year, and all I can remember was thinking, everybody has their teeth whitened now to get married. Everybody gets thin, and everybody has dance classes.
The dance classes.
Does that still happen?
Dancing? I don't think so. We did all the dance classes and then didn't even... My dress was so big we couldn't even dance. We were just like... So back to scarring.
Yes.
Stretch marks. Would you say that is a scar?
Yes.
It is a scar.
Yeah, definitely. But we get so many different scars. You get people who've been in accidents, car accidents.
Well, our soldiers that we help.
And now, our charity Back on Track, we help the boys with scarring from burns. So from incendiary devices that have gone off, from shrapnel wounds. And again, we use a lot of CO2 laser.
Yeah, CO2 is amazing, isn't it?
Yeah. But it's great for ageing, isn't it? Just for ageing skin. It will really freshen your skin up as well. But the scarring for the soldiers that we treat, the scars are usually, a few years old. They need quite a lot of treatment. And hopefully, I think we've done some good work on some of them, don't you?
Yeah, is it a lot of CO2?
A lot of CO2.
Fat
and
transfers?
PRP, fat transfer as well.
It's a
We had
mixture.
actually a patient who was from South America, and he had incredibly bad, severe acne scarring.
I know who you're talking
Yeah, I
about.
do. Lovely boy.
Yeah.
And he had Roaccutane when he was young, and his skin had stretched. He got very large scars, those really open scars. The skin was very thin and weak. And we did a combined treatment with CO2 and with PRP and fat transfer, and the results were stunning. So his skin was...
They were incredible.
So it was incredible, yeah. But we do a lot of that, so that's a good treatment.
I had surgery last year and the scar feels tight and itchy. Is that normal?
Well, one thing is, where is the scar? Is it an abdomen scar? Did you have an abdominoplasty? So scars vary from your body to your face. Really need to know where your scar was.
My stretch marks after pregnancy look like scars. Are they treated in the same way?
Yes, we do treat stretch marks very much in the same way. So a stretch mark is where literally the skin has stretched and there's nothing underneath it. So it's a very fine, delicate piece of tissue over the top. It's usually quite red to begin with, and it goes darker brown often, and then it will go to a very, very light scar. So we treat stretch marks a lot with CO2 laser. We treat them with morpheusate. They're all treatments that penetrate into the skin, and with PRP as well.
My child asks me about my scars every day. How do I explain it without feeling embarrassed?
I think if it's acne scarring, you just explain to the child, as you're growing up, your body started to change, you produce lots of hormones, and then you got spots, and left you with scars. And talk about it. Don't be embarrassed about it, because your child will learn from you that to be able to talk about things that are a bit delicate without being embarrassed himself or herself.
I keep picking at a healing scar on my arm even though I know I shouldn't. How do I stop?
Well, there are some great silicone gels that you can cover it with. Are you having treatment for it? Is it a long-term scar that you keep picking at? I think if I had to say one thing, it would be go to the pharmacy and get some silicone gel cover.
I'm a man with a scar under my eye. Do you think it would make me mysterious and attractive, or is that just movie nonsense?
Well, that's movie nonsense, isn't it? I think a scar is a scar. You have to live with it. You can reduce it as much as possible. I think we probably worry much more about scarring ourselves than other people. Look at it, notice it. I mean, sometimes people come in, I'm sitting talking to them, and I do this every day of my life, virtually, and I haven't noticed anything. And then they'll say, it's this mark here that I don't like. So I think we're very self-critical, and we notice much more about ourselves than other people do. So sometimes it's about not being over self-possessed.
My scar has grown thicker and raised over time. Could it be a keloid?
Yes, definitely sounds like it. Obviously, you need to go see someone who, is really trained. Come and see a doctor, see what they think. But yeah, that sounds like a keloid.
I had a burn that healed, but the scar is darker than the rest of my skin. Is there a way to fix the colour?
Yeah, so it could take longer to go depending on your skin type, but you'd need to go and see someone.
Is laser therapy safe for all skin types?
No. You have to be really careful. You have to be really careful, don't you?
Absolutely. The darker your skin is, the more careful you need to be, because often lasers can put more pigment into the skin. So if you've got a deep pigment, it'll make it darker.
If I get another surgery, can anything be done to reduce how much scarring I will end up with?
Definitely. So we use a lot of medical grade skincare, and then we monitor you to see how you're responding to your healing process. But there's things like PRP and exosomes. There's lots of things that we can do now to help.
I tell my kids that I got my leg scar fighting a shark, but really, I just fell over the Hoover. Should I keep the lie alive?
Definitely. Keep it up. It sounds really cool.
I like that one. So we're going to do 30 versus 70
Okay.
with scarring. So would you at your age, do you have any scars that you're bothered about or concern you?
I don't really, but I think it's how you feel psychologically about it. So if I have anything that I don't like, I think, what can I do about this? Is it worth the while? So I look at, is it worth the recovery time? Is it worth, do I need to have a general anaesthetic? Would I be bothered? What is the cost? So I take all that into consideration and I think, yes, actually, it's worth that for me. Or quite often I'll think, no, there's no point. So I think it's very personal, and I don't think it matters about age, really. I think for a lot of people, if it's been bothering them for 20, 30, 40 years, they still want to do something about it.
Yeah.
And why not? What about you?
So I wouldn't I'm so fine with my stretch marks. But I can imagine, obviously, people with much, like scars that are visible, probably. Or even scars that aren't visible, if it bothers you, like the stretch marks, I'm fine with. I don't feel like I need to do anything. But if they did bother me, I totally would.
But don't you think as well, sometimes it can be, people are very sensitive about scarring that another person in their life has commented on.
Yeah.
Or if a child has said something, or when you're a child and something happens, and other children are so awful sometimes. So it's very personal, isn't it?
I think if my husband had said something like, oh, then I'd feel, oh,
Of
God,
course you would, yeah.
You'd make you feel very
of course you
insecure.
would. Yeah.
You'd probably want to do something more, but I feel...
But I think I've just ditched the husband, personally. But anyway.
I like that, yeah.
If anybody is going to make you feel bad about yourself that you're in a relationship with, you really shouldn't be with them, should you?
No. But no, I feel so. I wouldn't personally at my age do it, but if it bothered me, then I would. So again, it's not age really.
It's absolutely how you feel about it.
Yeah.
Good.
Good.
Now, Sophie, you know, one of my things is about grooming. It's about...
I know what's coming.
I like to see people nicely groomed, particularly you. And I just wanted to say about your nails. I noticed your nails at the end of the week were popping off. So can I have a look at them? They look like they're popped off.
I know.
Very, very good. Very
I've
good
been
at
hiding them.
Very clever at hiding them. So let me have a look at those nails and see what's happening to them.
We'll see you next week.
See you next week.